Welcome to the Experience Better video podcast series. I'm Josh Beekler, and with me today is Molly Mayer from the Women's Health and Healing Center here in Grand Island. And today, Molly, we're going to talk a little bit about recovery after breast cancer. So I think it's probably not commonly known that therapy is involved with women with breast cancer. But tell me a little bit about your involvement with somebody who does have breast cancer.
So typically with our breast cancer patients, we see them preoperatively before they even have surgery because we do a lot of education with them. That education includes reducing their lymphedema risk as much as possible so that they don't hopefully have to come see me much long afterwards. Getting them fit with some garments and some different bras and camisoles that they're going to need for after they get done with surgery. And then getting some baseline measurements obtained. So we measure their arms to ensure that we can track lymphedema if that pops up, track their range of motion and their strength to ensure that that doesn't decrease post-surgically, and then answer any questions that they have before they go to surgery. We see them about 3 or 4 weeks after surgery as well, and then we rehab from there, improving strength, range of motion, reducing any pain, tightness, scarring, and then we help get them fit with any bras and prostheses that they need post-surgically as well to get them back to 100%.
So it sounds like a lot of education, but you mentioned some hands-on things too. So what kind of hands-on things do you do, afterwards?
Yes, we do a lot of hands-on. We do a lot of scar massage. So obviously post-surgery you're going to have scarring, which can impede lymphatic flow, causing lymphedema, which can cause a lot of tightness, which can cause a lot of pain as well. So we do a lot of manual stretching through the armpit area, because there can be some cording or some scarring through that area that can impede range of motion and cause pain. Like I said, scar massage, and plus we have to kind of reduce any swelling, reduce any tightness across that chest wall to ensure that if the breast is removed and there has to be a prosthesis fit, that will fit nice and smooth against that chest wall to look and feel appropriate.
Yep, so there's certainly, you touched on a lot of things that are, kind of secondary things related to the cancer. Maybe a lot of things people don't think about or maybe even totally understand that they're that's going to be involved with this after that diagnosis. So it's really good that we have experts like you to take care of people who have to go through that and have that education and knowledge. What's kind of a typical time frame? How long do you work with somebody generally, maybe after surgery? You start with them 3-4 weeks after surgery, but then how much longer do you typically work with them?
It actually significantly depends on what kind of treatments that they're doing. Typically surgery is sometimes the first line of treatment, and then they might have chemotherapy or radiation treatments from there on out. So it just very much so depends. Radiation, we like to see them through those treatments so that if they start demonstrating any significant reductions in strength because of chemotherapy, or start getting some neuropathy in the hands and feet because of chemotherapy treatments, or radiation treatments cause a lot of tightness in the shoulder and in the armpit and in the chest wall. We'd like to see them through those treatments so that we can continue to rehab them all the way. It's kind of a bad answer, but it kind of depends on treatments.
Right. Absolutely.
So depending on what their oncologist recommends.
Very good. Well, thanks for joining me today,
Yes,
and I'm
you.
really glad that we have a facility like the Women's Health and Healing Center to help folks recover from breast cancer and other related injuries. So
I agree.
very good. Well, thank you, and we'll see you again next time.
Yes, thank you.